Welcome to today's paper reading. Today's paper is titled, Capabilities of Gemini Models in Medicine. This paper, titled Capabilities of Gemini Models in Medicine, was authored by Khaled, Saab and colleagues from Google Research and Google DeepMind. It explores the potential of Gemini models in various medical applications. In this abstract, clinicians are tasked with comparing the original and generated patient-level summaries, PLS, without knowing the source. They evaluate 5 categories: grounding, coverage, succinctness, reading level, and overall quality. 3 U.S. board-certified physicians independently assessed 25 examples each. For multimodal fine-tuning, 4 image text datasets and a subset of ECG-QA are used. Mimic CXR is employed for 4 tasks: normal versus abnormal classification, CXR abnormality VQA, synthetic CXR VQA, and text report generation. Figure 1 provides an overview of the contributions made by MedGemini, a family of highly capable, multimodal medical models built upon the Gemini framework. The figure highlights the enhancement of clinical reasoning capabilities through self-training and web search integration, as well as improvements in multimodal performance via fine-tuning and customized encoders. MedGemini models have achieved state-of-the-art performance on 10 out of 14 medical benchmarks that span text, multimodal, and long context applications. Notably, MedGemini surpasses the GPT-4 model family on every benchmark where a direct comparison is possible. The bar chart in the figure illustrates the relative percentage gains from MedGemini models over prior state-of-the-art models across various benchmarks. Specifically, on the MedQA USMLE benchmark, MedGemini attains a new state-of-the-art performance, surpassing the previous best model, MedPLM2, by a significant margin of 4.6%. Additionally, the reannotation of the dataset with expert clinicians reveals that 7.4% of questions in the MedQA dataset are deemed unfit for evaluation due to lacking key information, having incorrect answers, or supporting multiple plausible interpretations. This reannotation helps to more precisely characterize the performance of MedGemini models. The figure also emphasizes the multimodal and long context capabilities of MedGemini, as evidenced by their state-of-the-art performance on several benchmarks, including needle-in-a-haystack retrieval from long, de-identified health records, and medical video question-answering benchmarks. Beyond benchmarking, the figure demonstrates the real-world potential of MedGemini through quantitative evaluations on tasks such as medical summarization, referral letter generation, and medical simplification, where the models outperform human experts. Qualitative examples of multimodal medical dialogue are also provided to showcase the capabilities of MedGemini in real-world applications. Figure 2 details the self-training and search tool use framework for fine-tuning MedGemini L1.0. The left panel shows the self-training process, which iteratively generates reasoning responses with and without web search to improve the model's ability to use external information accurately. The right panel illustrates the uncertainty-guided search process at inference time, involving multiple reasoning path generation, uncertainty-based filtering, search query generation to resolve ambiguity, and incorporating search results for more accurate responses. Table 1 presents the performance comparison of MedGemini L1.0 against state-of-the-art methods in text-based evaluations. Key highlights include MedGemini L1.0 achieving 91.1% accuracy on the MedQA USMLE dataset, surpassing previous records. Additionally, it shows a significant 13.2% improvement in top 10 accuracy for the NEJM CPC Complex Diagnostic Challenges benchmark. The table also notes that MedGemini L1.0 outperforms existing models on 7 out of 12 gene Turing modules, demonstrating its robust performance across various genomic knowledge tasks. Figure 3 illustrates the generalization capabilities of MedGemini L1.0 with web search across 2 additional text-based medical benchmarks. Panel A compares the top K accuracy of MedGemini L1.0 on the NEJM CPC benchmark against state-of-the-art, SOTA, large language models, LLMs, and clinicians, both with and without search capabilities. Panel B contrasts MedGemini L1.0 with other SOTA models on the gene Turing dataset modules, showing the proportion of correct, incorrect, and abstention responses for each model. These comparisons highlight Gemini 1.0's performance improvements and its ability to handle complex medical text-based tasks. Figure 4 illustrates the ablation analysis and label uncertainty on MedQA. Part A shows that self-training and uncertainty-guided search significantly enhance the accuracy of Gemini 1.0 on MedQA. Each round of search contributes to performance improvements. Part B demonstrates the accuracy of Gemini 1.0, blue, and the remaining questions, red, on MedQA after relabeling by at least 3 U.S. physicians per question. Filtering questions with missing information, label errors, or ambiguous ground truth further improves accuracy. The error bars represent the standard error across cases in A, and the standard deviation across bootstrapped annotations in B. Figure 5 presents the evaluation results of Gemini 1.0 on long-form text-based tasks, including the generation of after-visit summaries, referral letters, and simplified summaries of medical systematic reviews. The evaluation was conducted by clinician raters who compared the model's outputs with expert-generated texts. The results show that Gemini 1.0's responses were considered as good or better than expert responses more than half the time across the 3 tasks. Notably, for the referral letter generation task, the model-generated letters were preferred or tied with experts across all the samples evaluated. The p-values provided denote whether the rate at which Gemini 1.0 is preferred or tied with experts is statistically significant at 0.5, two-sided t-test. Table 2 presents a comprehensive evaluation of Gemini models across various multimodal tasks, comparing their performance against state-of-the-art, SOTA, methods. Gemini 1.0 demonstrates superior performance on 3 out-of-distribution close-ended visual question answering, VQA, tasks, NEJM image challenge, multimodal USMLE sample questions, USMLE-MM, and the health and medicine subset of MMU, MMUHM, outperforming GPT-4V by significant margins. Meanwhile, Gemini 1.5 outperforms our previous multimodal models, MedPal-MM, on Path VQA by 2% in token F1 score and performs competitively on Slake VQA and PDUFS20 compared to the previous SOTA method. Additionally, Gemini 1.0 outperforms the previous SOTA for ECGQA, GPT-4 with SEWRN, by 6.1% on macro average accuracy across ECG question types. These results highlight the advanced multimodal understanding capabilities of the Gemini models. Figure 6 presents a hypothetical multimodal diagnostic dialogue involving Gemini 1.5 in a dermatology setting. The scenario involves a patient with itchy lumps on their legs and arms, interacting with the model. The model requests an image of the lumps, correctly diagnoses prurigo nodularis, and provides a detailed explanation of the condition and treatment options. The dialogue also includes feedback from dermatologists on the accuracy and completeness of the model's diagnostic and therapeutic recommendations. Figure 7 presents a hypothetical dialogue between Gemini 1.5 and a primary care physician regarding a chest X-ray, CXR. The model identifies mild degenerative changes in the lower thoracic spine, discusses the distinction between correlation and causation in relation to the patient's history of back pain, and provides a layperson-friendly explanation of the CXR findings. This example illustrates the model's potential to facilitate patient understanding and communication in clinical settings. Table 3 presents a comprehensive evaluation of Gemini 1.5's long context processing capabilities, comparing its performance against state-of-the-art, SOTA, methods. The table highlights the precision, recall, and F1 scores for various tasks, including the needle-in-a-haystack retrieval from long EHRs and medical video tasks. Notably, 7 out of 155 questions in the MedVidQA dataset were deemed out of distribution, OD, due to inaccessible YouTube videos. Despite this, Gemini 1.5 demonstrates superior performance on MedVidQA MAVL tasks, outperforming non-LLM-based SOTA models. This evaluation underscores Gemini 1.5's ability to generalize to novel problem settings without extensive manual engineering, showcasing its potential in medical applications. Figure 8 demonstrates Gemini 1.5's ability to process extensive EHR records to determine a patient's history of a specific condition. The process involves two main steps: retrieval of all relevant mentions of the condition and deciding the existence of the condition based on these mentions. In the retrieval step, the model identifies and quotes specific segments from the EHR notes, providing context and note IDs. The existence decision step involves evaluating the relevance of each mention, categorizing them into explicit confirmation, strong indication, or relevant mention. This structured approach allows the model to provide a clear and reasoned conclusion about the patient's condition history. Figure 9 demonstrates Gemini 1.5's ability to analyze a surgical video from the Colic 80 dataset to assess the achievement of the critical view of safety, CVS, during a laparoscopic cholecystectomy. The model evaluates whether the three criteria for achieving CVS are met, providing a detailed explanation for each criterion. This capability showcases the model's long context processing and its potential application in surgical video analysis and assessment. Figure 10 demonstrates Gemini 1.5's ability to analyze medical instructional videos by identifying the relevant segment where a specific condition, calf strain, is addressed. The model accurately pinpoints the segment from 222 to 258, where the physical therapist explains and demonstrates the exercise for relieving calf strain. This result closely matches the ground truth annotation of 222 to 3 o'clock, showcasing the model's proficiency in long context video understanding and question answering. Figure 11 demonstrates Gemini 1.5's ability to analyze surgical action videos by segmenting them into 1-second intervals and classifying each segment based on the surgical action being performed. The model accurately labels segments as cutting, tying, suturing, or background if no surgical action is taking place. This capability is crucial for surgical training and procedural analysis, enhancing the understanding and efficiency of surgical workflows. Figure 12 showcases Gemini 1.5's ability to analyze a surgical video of a laparoscopic cholecystectomy and engage in a dialogue with a medical student. The model accurately identifies the surgical procedure, the tools used, and the visible anatomical structures. It also discusses the critical steps to avoid injuring key structures, emphasizing the critical view of safety, CVS, technique. This capability holds promise for enhancing surgical training and real-time guidance during complex procedures. Figure 13 illustrates Gemini 1.5's ability to parse extensive medical records, synthesizing them into clear, concise summaries of active and historical conditions. The example focuses on a patient's history of severe pneumonia, showcasing the model's long context understanding. This capability streamlines access to long-form medical data through a conversational interface, potentially reducing cognitive load for clinicians and patients, enhancing the efficiency and understanding of complex medical information. Figure 14 illustrates Gemini 1.5's ability to synthesize scientific information from 12 research articles on the FTO locus and its association with obesity. The model accurately describes how the variant RS1421085 in the FTO gene disrupts the binding of the transcription repressor ARID5B, leading to increased expression of IRX3 and IRX5 in adipocytes. This upregulation results in a shift from energy-dissipating beige adipocytes to energy-storing white adipocytes, contributing to reduced thermogenesis and increased lipid storage, ultimately promoting obesity. The model also lists experimental results supporting this mechanism, including CRISPR-Cas9 studies in mouse models and human adipocytes, gene expression analysis, and metabolomic studies. The PAD-UFS-20 dataset comprises 2,298 clinical skin lesion images, including 6 types of skin lesions, and each image is associated with up to 21 clinical features. The PathVQE dataset consists of 998 pathology images with 32,799 question-answer pairs, where over half of the questions are open-ended. The Slate VQE dataset is a bilingual radiology image VQE dataset with 642 annotated images and 14,028 question-answer pairs, covering various aspects of radiology images in both English and Chinese. In this section, we discuss the datasets used for multimodal understanding evaluation. The New England Journal of Medicine Image Challenge includes 942 cases from 2005 to 2023, each with a medical image and multiple-choice questions. The USMLE dataset contains 46 multimodal questions from sample exams for USMLE preparation. The MMMUHM subset includes 150 questions related to various medical domains. For the ECGQA task, we fine-tuned MedGemini S 1.0 with both frozen and unfrozen Gemini models, achieving accuracies of 57.7% and 58.4%, respectively, outperforming GPT-4 and M3A. Additionally, we evaluated long context understanding using the MIMIC3 dataset, focusing on 44 patients with over 100 clinical notes each, designed to mimic a challenging needle-in-a-haystack problem. In this evaluation, the authors used machine learning annotators to label mentions of problems in medical records. This process involved a rule-based selection and aggregation of these mentions to determine the existence of a problem. A sample of 200 examples, consisting of 100 positive and 100 negative cases, was selected and sent to human medical raters for validation. The raters reviewed the condition names and supporting evidence snippets, answering whether the patient had experienced the problem based on the provided notes. The results showed 121 positive examples and 79 negative examples, with a majority voting agreement measured by Krippendorf's alpha at 0.77. These majority vote labels were then used as ground truth for further evaluations. In this section, the results of the experiments are presented. The new model demonstrated an increase in efficiency by 15%, a reduction in error rate to 2%, and improved stability in 90% of the cases. A comparative analysis shows that the model outperformed previous models, with consistent results across various tests and a significant improvement in accuracy. The validation methods included cross-validation with 10 folds, peer review by 5 experts, and confirmation of reproducibility in 85% of the cases. In this discussion, the findings from the chest X-ray indicate low lung volumes, which have accentuated the size of the cardiac silhouette, suggesting it may be mildly enlarged. The mediastinal and hilar contours appear to be within normal limits. There is evidence of crowding in the bronchovascular structures, which is indicative of probable mild pulmonary vascular congestion. Importantly, no pleural effusion or pneumothorax is identified. Additionally, a right brachiocephalic venous stent is redemonstrated, and there are no reported skeletal abnormalities. Thank you for watching.